Thank you so much. I'm so honored to be here today. We at the National Health Council talk a lot about the patient journey and the patient journey of getting to diagnosis, of getting to treatment, of getting to independence and wellness. And I cannot, in my heart, think of three better examples of that journey. If I could clone the three of you and really just take you on my work every day, I would. So I just want to start by saying that I'm just blown away. So I have the dubious honor of following these wonderful stories, but just wanted to talk a little bit about some of the issues that we as patient advocates are working on, looking at on the Hill. And I've particularly been charged with talking about things focused on access and affordability. So many of you in the room have real life examples and know all of this almost better than I do. But I want to talk about some of the messages that we at National Health Council bring up to help create policies and programs and supports that really work within that patient journey. We often say that the best care in the world, the best diagnosis, the best treatment, it doesn't matter if an individual patient can't access it, can't afford it, can't get to it. So we want to make sure that when you're up on the Hill, when we're doing our work here in DC as advocates and allies, that we are making sure that decision makers are listening to patients and to listening to you all about what are the things that are obstacles, what are the things that are smooth the path, what are the things that are issues around access and affordability. We really need to make sure on access that we listen to patients, identify the challenges. This could be everything from very small things like transportation, time off work, those kinds of things, to big issues around geographic settings and where the healthcare system is and is not, and things like that. On affordability, too often, particularly in DC, the discussion around healthcare is about the system. How do we make sure that, insurance and Medicare and Medicaid are there and fiscally sound and we're saving money and all of that, which is all very important discussions. But we want to make sure that they're also listening to individuals about what are the things in their individual pocketbook, and that just aged me tremendously using the word pocketbook, sorry. Pocketbook, what are the things that you're actually paying for that make a difference in your budget, your life? Making sure that you're sharing those stories are really important. There are a couple things specifically that I wanted to talk about that Congress is looking at right now that affect access and affordability. The first is Medicaid, making sure that we know that how important Medicaid is to people who have chronic diseases and disabilities, particularly to people with rare diseases who may have a longer diagnostic journey, may need more specialized care, all of those things. It's really important that that is a program that is working and available and has the most flexibility to serve people for what they need. And a lot of what we were talking about around specific asks affect that. Just moving on. The other thing is telehealth. I think for so many people with chronic diseases and disabilities, the access to telehealth that came in during COVID and other things, and the comfort level with that now has made a huge difference. I have several friends with very rare diseases who have to travel 2-3 times a year to Boston or wherever for the one specialist that knows them. Having the ability to check in with people who are specialists, who are working on your rare disease specifically, or just getting your everyday care. I was talking to a gentleman from rural Wisconsin yesterday who has COPD, fairly common, issue with older adults, and he's like, I can check in with my pulmonologist regularly. I don't have to drive 2 hours and sit and meet with them. So access to telehealth. There are flexibilities that have made that available that Congress needs to act on in the next several weeks, actually. So talking about that is an important access issue. The other thing that we've been spending a lot of time on is patient engagement generally, but patient engagement in decisions at the Center for Medicare and Medicaid Services, which is the agency that oversees those two programs. We've done a lot of work, and led by a lot of you in the room over the last several years, around making sure that drug and device development and those kinds of decisions are made with patients from the very beginning, in the design of it and the basics of it. And we've made so much progress there, but we still have huge places to go, I think, around making sure that patients are part of the decisions around coverage decisions in Medicare and Medicaid, around what demonstrations and models are people using, and what decisions are being made at the Department of Health and Human Services and other places. So in short, for people with chronic diseases and disabilities, particularly those with rare diseases, access to the tools they need and their providers need to diagnose, to treat, and generally maximize people's health and independence is critical. And I'm just so thankful that you are all here, that you are all telling your stories, and beyond impressed. So thank you all.